Hey, everybody. Welcome back to the Outcomes Rocket. So thrilled that you joined us again today because I have an extraordinary guest. And I've got the privilege of having Yoni Shtein with us. He's the CEO of Laguna Health. He's a technology entrepreneur and investor with over 15 years of experience at that intersection of tech and finance. As a CEO and co-founder, Yoni brings his passion around data and impact to really help improve people's lives. I'm excited to have him on because, look, in healthcare, we need that splice of other industries to really move the needle forward and catch up. Yoni, appreciate you being with us.
Thank you for having me, Saul.
My pleasure. My pleasure. So you guys are focused on care managers and really bringing in automation to the space. We're excited to cover that. But before we do, Yoni, tell us a little bit about you and why you got into healthcare.
Sure. I think my path getting into healthcare was long and arduous, which I think is kind of typical for most healthcare entrepreneurs. They always have some compelling event, if you will, that gets people like us passionate, excited, and driven enough to not give up in this important space. But so I started out actually as a software engineer at Microsoft. This is some 20 years back, which is exciting because both kind of set my engineering foundation. And as importantly, this is how I met up with my co-founder of Laguna, Yael, Adam. Both of us as geeky software engineers that then had a detour in business and finance for about a decade at a pretty exciting startup that went public out of San Francisco and then spending some 7 years at a large private equity and credit fund, in the midst of which unfortunately lost my mother-in-law post-hospital discharge, which was a pretty dramatic shakeup in my life, and got us to move and me leave finance and invest my time, passion, and attention in healthcare, which is how we got here.
Amazing. Well, look, it's a winding road, but you're here. And yeah, definitely awesome work that you did at RPX, some big wins and sort of what's followed from that. Excited to dig in here. Let's talk about Laguna. What does the company do and how are you guys adding value to the ecosystem?
Absolutely. So Laguna is a conversational care intelligence solution for care managers, really helping them to drive efficiency and effectiveness. Sounds perhaps a bit kind of high level. I'll unpack that a bit.
Yeah.
Care managers are essentially driven nurses, social workers, often employed by health plans, health insurance companies. And, kind of as they have to balance large and growing caseloads and individual empathy and attention to every member they speak with, usually quantity takes over, and kind of given the stretching caseload, it's really difficult to be empathetic to every single individual time and time again, while they have to take notes and go through scripted workflows. That is the core problem we're helping them solve by doing several really important things using conversational intelligence, or specifically kind of natural language processing and generative AI to first and foremost take all the low value work away from them, automating documentation, what is now these days is ambient listening. They should not be doing that quote unquote low value work. They should be paying full attention to what and how the member is presenting, be it voice, chat, text, whatnot. Above and beyond that, we also help them to drive effectiveness. So to pinpoint what is being said in real time and offer some of the specific pathways that the plan and ecosystem that they work with is available to help for that member. And last but not least, we're also helping the care managers improve, as we're also paying attention to what and how they are saying, which provides fertile ground for training and improvement on that front.
That's really great, Yoni. And essentially, your customers payers. Am I hearing you right?
Yes.
Okay, great. And you're helping them with their care management process, which the numbers are staggering, right? I mean, they're just like the physicians. They're just up to their eyes.
They're up to the rise. And it's funny, you mentioned physicians, right? Because we're living in a really exciting time of conversational intelligence, or specifically ambient listening. And to your point, what I find is that majority of the attention goes to the providers, the physicians, the clinicians, to drive more efficient throughput of patients, if you will, and kind of the economics are conducive to it, et cetera. Much less attention and solution is being kind of paid and provided to the payers that have as much, if not more, interest on the line and are quite aligned actually with all of ours health and well-being economically, if nothing else, and from a mission standpoint as well on top of that.
No, that's fantastic. And folks, if you've been following the podcast, you've heard the interviews we've done with the folks at Abridge. You've heard the interviews we've done with the legacy nuanced folks now at Microsoft. And what I love about what Yoni and his team are doing is that there's so many aspects of healthcare that could benefit from these LLMs. And here's a sweet spot. And you guys could own this, right? Like you guys are owning this. And that's the beauty of it. You don't have to go to a crowded market to make a difference with the technology that is so exciting in healthcare. So talk to us, Yoni. What's making the difference? Like, what is it that you guys do that other people don't in this particular vertical?
No, I think that's a good opportunity to double click into the arduous journey of company building, right? And kind of before we got to this, which is really kind of where we found massive interest and traction and growth in the market, we started from the post-acute space. And in looking in post-acute transitions, the first problem we're looking to tackle is what is the optimal care model? And it turns out that it's not just the clinical aspects that get people in trouble along the care journeys. It's also the social and individual determinants of health, as we call it. So kind of one of the first things we did was codify all of that, which is really exciting because once you're able to do that, several things are enabled. First and foremost, you get to speak to results. And so we've done multiple randomized clinical trials with the likes like Mayo Clinic, North Shore, publishing outcomes. By the way, massively conducive to working with payers. Not as much the case with efficiency-oriented providers, very much the case with payers who are absolutely looking at efficiency, but also looking at outcomes and cost savings. Two, it enabled us to have a tagging infrastructure and a data lens, essentially, that enabled us to build a differentiated, if you will, large language model that enables us to not only take kind of that low value documentation work away, but also elevate to help care managers practice at the top of the license, as it's often called, by paying attention to clinical and non-clinical factors in real time.
That's fantastic. And the differentiators, I guess, Yoni, is that data set, right? Like the data set you've been able to put together, your own, unique language model that helps you bring forth the insights that you're bringing forth.
Exactly right. And kind of in the time and age we live in where you have unbelievably robust platforms like Gemini, OpenAI, et cetera, that subject matter expertise and data moat is really what sets you apart and creates that not just differentiation, but I would call kind of sustainable differentiation over time.
I love that. And so for the payers listening, how can we help them understand what setbacks you're helping them overcome? Like what's life like before Laguna and what's life like after Laguna?
Absolutely. So there's several ROI opportunities we're helping them drive, not unlike any other co-pilot, if you will, or set of technologies that help all of us become more efficient, more effective. It really depends on how we want to utilize it. So specifically, helping them cover more members with the same care team, helping them be more effective with the members they are covering. Namely, it's just not just kind of become more effective efficient administratively speaking. It's also more effective from a medical loss standpoint. And then last some payers that work with us are looking to optimize and rationalize the administrative spend they have on care management as well. That is another ROI lever that they get from Laguna. So to kind of bring it back full circle, it really depends on their individual strategic goals and kind of the tools that we have help them unlock it.
So like my brain's going to Medicare Advantage HEDIS measures, that kind of thing? Is that, am I tracking with you, or?
So that is a really interesting bonus that goes above and beyond everything I just said, because being able to again, kind of to our humble beginnings in post-acute and kind of closing care gaps, reducing readmissions, unlocking Z codes and risk management, all of that is being done more efficiently and more effectively on the fly. In addition to the core KPIs that I mentioned, which are, again, driving higher efficiency, as much as 30% higher efficiency from the same care team. That's a lot if you think about the millions and tens of millions, depends on the size of the team they invest in that. And then better outcomes as measured by medical loss as well.
Love that. And then you compound that efficiency over time. You're really adding major value. And so, one of the questions I ask next usually is key trends or technologies. We're talking about those, right? Like that is the essence of Laguna. You guys are. So maybe the question that I'd like to ask you, Yoni, is one about thinking. What's one key way you would challenge today's leaders to think differently?
I was trying to recall on a line that someone once told me, whereby agreeing to everything or disagreeing with everything are both the same, because both absolve you from the need of thinking.
Yeah.
And what I would caution and encourage decision makers in the industries to not to fall in that trap as it relates into the very exciting NLP and Gen AI tsunami we're in. So no, I don't think, like most trends, that this will solve everything. Nor do I think this is all BS, pardon my French. And as ever, God or devil, be it as if, hey, is it the details? And I think it's actually quite nuanced and fascinating, right? Kind of be it pockets of value that are proven and exist of AI in healthcare, and some of the nuanced solutions, again, to your point about be it nuance or a bridge. And yeah, I have a ton of respect for those solutions, focusing on driving value for providers and appreciating the nuance and differentiated opportunity and need and proven value for payers. So again, I think some of that detail matters, and that is the crux of the opportunity that we're looking at. And I think of the opportunity for some of our customer set to differentiate from some of the noise, if you will, and the signal of value.
That's fantastic, Yoni. Yeah, I love that tip here. And at the end of the day, it is about thinking, right? Like let's think our way out of these problems. Let's think with our partners, solutions like Yoni's Laguna Health, to really find a way to get consumers, and I'm saying consumers intentionally, what they want in healthcare, because we're demanding it. And now is the time. As people are listening to us, Yoni, what closing thought would you leave them with? And what's the best way for them to learn more about you and engage with your team?
I think we're in a really, just for as kind of closing thought, and, kind of on the heels of the previous question answer, really exciting time in healthcare. And I'm saying really exciting, not as much as far as kind of, in COVID, it was an exciting time, but it was an exciting time because there was this wave of tsunami and of attention and funding and overall excitement, probably over the top. Now, I think there's a real wave of opportunity and a confluence of factors between the technology and predictization of it in proven segments or niches within it, and that are paired with decision-making interest in that. So it's a really exciting time to be building, scaling, and at the end of the day, to your point about consumers, delivering tangible and proving value to our customers. Super happy to speak about that and more with folks. I'm reachable on either LinkedIn or email at Yoni, YONI, at lagunahealth.com.
Amazing, Yoni. Thank you for that great call to action. Folks, now's the time, and you don't have to do it alone. That's why leaders like Yoni are building platforms that your organization can leverage and take your teams, your resources to the next level. Yoni, thanks for being with us. Really, really enjoyed our time today.
Same here. Thank you for having me, Saul.
My pleasure.